COVID-19 vaccinations are getting prepped for rollout here in South Carolina. Joining us with a schedule is Dr. Jane Kelly, Assistant State Epidemiologist for DHEC. Thank you for joining us. A lot of people are anticipating getting a vaccination. There's some trepidation by certain people because we've heard just those couple of stories that we hear of people getting an allergic reaction and so forth. They're kind of nervous. Is there anything to be nervous about?
Of course, these are new vaccines, so I understand people are nervous about them, but I'd like to remind people that in the phase 3 studies, they studied both of these vaccines in tens of thousands of people and did not have any serious adverse reactions. Now, of course, now in the United States, we've had more than 10 million people receive the vaccine, so I'm not surprised that we are having a few allergic reactions to that vaccine. To other vaccines, allergic reactions happen about 1 in a million doses of vaccine. For COVID-19, it looks like it's a little bit higher, maybe 3 to 5 doses of vaccine causing an allergic reaction out of a million administered. Mm-hmm. So it's a little bit higher, but not much.
Okay. Is there any kind of preparation that patients should do before they receive their vaccination, such as maybe getting an allergy test, or is there anything that we know about those reactions that people can better prepare themselves for?
Some of those reactions were unanticipated. They were in people who had never had an allergic reaction to anything before. So for everyone, we recommend when you get the vaccine that there be an observation period, that you sit there and wait for 15 minutes just in case you have a reaction that they need to treat you with medication. For people who have had an allergic reaction in the past, and I mean a severe allergic reaction to food, medication, or another vaccine, it's recommended that they wait 30 minutes after receiving the vaccine for observation.
I see. Okay. What are the brands of vaccinations that are coming to South Carolina?
There are 2 vaccines that are authorized for emergency use, and we have received them and are using them now in South Carolina. They're very similar. One is the Pfizer vaccine. That's the one that needs to be kept at the super cold temperature of minus 90 degrees Fahrenheit. And we are rolling that out first in healthcare provider settings. So workers in healthcare settings, such as hospitals, urgent care centers, clinics, but also EMS, first responder community workers. They are also receiving that Pfizer vaccine. The other vaccine is made by the company Moderna. The Moderna vaccine is a little easier to handle logistically because it needs to be kept just at normal freezer temperatures. And we are beginning to use that among people who are living in or working in long-term care facilities, such as nursing homes. Once we have those persons covered in the nursing home setting, we'll start to have the Moderna vaccine available for the rest of the population in South Carolina as well. Okay. And I would remind your viewers, there are some other vaccines in the pipeline that may become available in the spring.
Okay, and let's talk about the schedule, shall we? So first responders, those people on the front lines, those, of course, are going to be receiving the vaccine or have them available to them first. But let's go through the schedule. So phase 1A, that's currently underway. And who is that for?
Mm-hmm. So that is for workers in healthcare settings. And I phrase it that way because it's not just doctors and nurses. It is also pharmacists. It is nurses' aides. It is any individual who is working in a healthcare setting who might be at increased risk of being exposed to SARS-CoV-2, the virus that causes COVID-19. Okay. And also those persons in long-term care facilities, because those are the people who have been most vulnerable. The majority of deaths from COVID-19 in South Carolina have been among people who are of an older age, and especially if they're living in a congregate setting, such as a nursing home.
All right, with just a few seconds left, as we move into phase 1B, that's happening in late winter. Who are those going to be for?
And let me make one other comment I neglected during phase 1A. Right now, we are also vaccinating persons age 70 and above, again, because they're at increased risk of severe disease and death. Phase 1B is when we can vaccinate persons who were working in a healthcare setting who didn't get vaccinated in 1A, persons who are living or working in what we call congregate settings. That might be homeless shelters, individuals in correction institutions, correctional facilities, as well as frontline essential workers who are at increased risk, unavoidable occupational increased risk of exposure to SARS-CoV-2. So
Same
that's
thing.
not
When you go
all.
into the grocery store, I mean, those would be considered people who are exposed to the virus.
Yes.
1C, I think my camp is in that particular phase. People in the media. I understand that there might be a chance that we could get bumped into 1B, but 1C and phase 2, those are happening in the early spring to late fall, so that people can better understand where should they go to find that information.
And it is difficult to hang a calendar date on some of these things because it all depends upon supply, demand, and whether some of these newer vaccines get approved and we have an increase in our allocation of vaccine. But if you visit our DHEC website, you can Google DHEC COVID vaccine, and there'll be information about who's included in which phase, what to do right now if you're 70 and above, and we'll be updating that as new information emerges and as we transition to phase 1B.
And of course, it's ideal if everybody gets vaccinated here in South Carolina. We've got about 5 million people living here. 70% need to be vaccinated to obtain herd immunity, as we talked about earlier before we got started. But we certainly hope that the rollout happens seamlessly. And I want to thank you so much, Dr. Kelly, for joining us today.
Thank you.
We're back after this.